Hello, listeners. You're in for a treat today. Joining us is Dr. Kathleen Markey, a powerhouse in international nursing education and a passionate advocate for culturally competent care. Dr. Markey is a senior lecturer and the course director for international studies at the University of Limerick, where she's shaping the next generation of globally minded nurses. But that's just the beginning. She's also driving force behind innovative research on migrant health and cultural diversity, collaborating with the World Health Organization and leading national seminars using art-based methods to spark real conversations about healthcare. Whether she's in the classroom, leading research, or championing patient voices, Dr. Markey's work is all about making healthcare more inclusive and responsive for everyone. So, get ready for an inspiring conversation with someone who's truly changing the face of nursing, Dr. Kathleen Markey. So, Dr. Markey, welcome to ETNAtalks. It's an honor to have you with us today. Then let's begin with the heart of your work. What does transcultural nursing mean to you, and how has it shaped your approach to both teaching and patient care?
Firstly, I'd like to say thank you so much for the opportunity to talk with you today. I'm truly honoured to be part of this series. I suppose, what does transcultural nursing mean to me? Well, I have to firstly reflect on my career to date. I've been very fortunate in my career to have such amazing, inspirational, and influential transcultural nursing role models and experts, and to have had opportunities to work with them and indeed learn from them. So, in particular, Professor Rena Papadopoulos, Dr. Mary Tilkey, and Dr. Georgina Taylor. And they've been so influential in shaping my passion and commitment to transcultural nursing, and specifically the importance of our fundamental role as educators in educating a future workforce to work in this increasingly culturally diverse healthcare services. So for me, transcultural nursing is very much back to the basics. How do we provide quality and safe nursing care that meets the individual needs of patients from diverse cultural, ethnic, and linguistic backgrounds? And I think for me, it's about bringing it back to the basics, not seeing transcultural nursing or cultural competence as something different or something separate to what we do every day, but to ingrain it in what we do. And to do that, I think we firstly need to focus on us ourselves. We need to be thinking about our own awareness. What's our own cultural identities? What's our own beliefs, our own values? And really having a mindstone of an awareness of being culturally aware of our own beliefs and values before we can think about understanding the beliefs and values of others. And this does require a continuous self-critical questioning of ourselves, being aware of our own values, our own norms, and even our own potential stereotypes or biases that we might have, that we might be aware of, or that we might not be aware of. Secondly, transcultural nursing means very much the role of us being able to, as healthcare professionals, to acknowledge and respect when there are cultural differences, specifically in terms of how culture informs perceptions of health and illness, health-seeking behaviour, healthcare treatment, and even expectations of patient-nurse interactions and healthcare. And very much to do this, I think we need to feel comfortable to, acknowledge that we don't know everything, and it's not required for us to know everything, but to feel comfortable to engage with patients, to listen to their needs, to their preferences, and to be curious and courageous to learn from them and with them, and indeed about them. But there's always the risk of becoming preoccupied or over focusing on what is the differences. And I think for me, we need to stand back and spend more time exploring what those similarities are. So what are our similarities in our beliefs and our values? And to be empathetic with our patients, but also with ourselves,
Yeah.
so that we can really engage meaningfully with our patients.
Yeah, totally agree. I mean, we have to be empathetic with ourselves. It's like we have to take care of ourselves as well. I wrote down here the sentence you said, back to basics. I have a PhD student, and we are always discussing with this back to basics because she is discovering in her data that at the end, even though she's working, I mean, she's studying advanced practice, at the end, it leads to back to basics again. So I loved you said that because I will tell her. I mean, Dr. Kathleen Markey said also back to basics, and also I loved the sentence you said. We don't know everything, and I would add, I don't want to know everything. I want to be awake every day and discover new things and discover my own mistakes and keep learning, keep learning. Otherwise, it's kind of boring. It's like, yeah, it's like I don't want that.
Yeah. And I think also it's about, having the courage to say, I don't know, nor I'm not expected to know,
Yeah,
but also the courage to sometimes challenge ourselves, to question ourselves.
yeah,
And I think that whole mindset of inquiry
yeah.
really comes to really the fore when it comes to transcultural nursing.
Totally. And also that it's like a life process because it's like maybe what you know now, maybe in 10 years it's going to be different and you have to change your mind and you have to change your, I don't know, your theoretical beliefs or whatever. So it's like an open process. I love that. And Dr. Markey, could you share like a memorable experience where cultural competence made a significant difference in your work with either students or patient, and why was that moment memorable?
Yeah, I suppose I have many
Yeah, yeah.
experiences. Um, One that really strikes me as one that's been particularly memorable is perhaps a more recent experience. So, in Ireland, as part of nurse education, we do a lot of reflective practice, where we kind of facilitate group reflection with groups of undergraduate nursing and midwifery students, asking them to share their experiences from practice and what can we learn from their experiences and to get them to think about what we could do better. And what's interesting is quite often cultural aspects of care doesn't overtly come into those reflective practice discussions. And that might be because people don't see it as important or as juicy as perhaps, the acute care element of
Yeah.
dealing with somebody who's unwell. And this one particular student, and it's only a recent event that really strikes me. So she was reflecting on an incident from her practice, and it was very much about something she felt didn't go well with regards to her care delivery. Um, and that was culture wasn't what she aimed to explore in her reflection of her incident from practice. But one of the issues she had said was, I had this patient who was from a particular religious background, and I was given and providing health education and health information, but they were just not compliant with the advice. And I think those words, not compliant,
Complying.
really
Yeah.
struck me. So when we delved in much deeper, we actually came to grapple with this whole area of cultural competence that was not intended to come up in the conversation, but that was the most meaningful learning. So actually having opportunities to say, well, actually, what was the not compliance meaning? And in particular, what this very much showed was ethnocentricity of the individual. They felt that their beliefs and values around health education and health rehabilitation was the only way to provide healthcare delivery instead of stopping to take stock of actually what are the cultural beliefs, the cultural values, and cultural norms of the patient that they were providing the health education for. So for me, that was a particular moment that was accidental learning, but was so powerful learning, not just for the student who was reflecting on her incident from practice, but for the group of students listening and sharing that meaningful experience to get them to stop and think, actually, we do, culture comes into everything when we're caring for patients. And we need to very much stop and take stock that, how we communicate, how we're perceived as healthcare professionals, but also how we're understanding our patients' care preferences and their perceptions of healthcare delivery,
Yeah.
and to really make sure that that marries. So for me, that was a particular memorable experience. And it was like a light bulb moment had gone off with the student. And I have no doubt that that light bulb moment also infiltrated the entire classroom, because other students were like, aha,
Yeah.
that's what we're talking about. And I think, one of the issues for us as educators is feeling comfortable to facilitate those discussions. And, they can be sensitive because, in some regards, originally the student actually took a step back and thought, actually, I was being culturally insensitive, although I wasn't aware of it.
Mm.
But yet, that powerful learning, if it's handled sensitively and meaningfully and really in true dialogue with the students, then what's important is that they acknowledge, that there is a whole plethora of learning to happen, that cultural competence is a continuous learning cycle, and that being comfortable to acknowledge that they don't know and being courageous to find out and to talk to their patients in that conversation to find out their preferences and their care needs.
Yeah.
I have no doubt that change will occur as a result.
For sure, I'm sure. And also for me this is the importance of meaningful learning, as you said, because she was able to reflect, she was able to identify why this was disturbing, or why she was uncomfortable, and also the rest of the classroom. So this is another proof for me that I really prefer reflective learning or active learning rather than memorizing things and all these protocols and list of tasks. So at the end it's like a, I don't know, like a deeper learning. I love that. And also as a course director for international studies, how do you help future nurses to develop the skills they need to provide this culturally competent care?
Hmm. Well, I suppose I come from a philosophy, and I've learned from the gurus of cultural competence, that every learning opportunity in nurse education is an opportunity to create
Totally.
awareness of cultural diversity in healthcare services. And therefore, it should incorporate ways of developing the knowledge, skills, and attitudes that is needed to prepare our future nurses to work in an ever evolving culturally diverse healthcare system. So I very much believe that every learning opportunity is an opportunity to integrate cultural competence learning and development. So it should be infiltrated in all learning opportunities, not seen as an add-on or as an extra. So I thrive to and strive to ingrain that integration of cultural competence in every learning opportunity. And I think that's particularly important as my role as a nurse educator, but also a course director who's involved in the overall management of the program of studies. So
Mm.
I also have the role of, um, I suppose, aiming to influence my colleagues to infiltrate the same approach. And adopting such approach really does need to happen at curriculum design stage. When we talk about nurse education, again, we need to step back and think, okay, when we are preparing our graduates, it is about preparing them to work in an ever evolving culturally diverse healthcare service. And that is about designing our curriculum to ensure it does that, but also at a local level, planning learning, teaching, and assessment approaches and strategies to also do that. So, for example, the use of simulation, um, the use of role playing scenarios, really working with community partners and NGOs, non government organisations who support migrants and patients from diverse cultural and ethnic and linguistic backgrounds, to really invite them to become partners with us in this journey to support intercultural and culturally competent learning.
Yeah.
And so that's something that I really do pride myself in doing, because I think that is, that's so important. It's making learning real and impactful. Um, and, sometimes it doesn't have to be complicated. So we do quite a lot of simulation as part of our undergraduate nursing and midwifery programs, so we simulate practice environments, and, having scenarios where perhaps, the focus of the module might be on, for example, surgical patient care. But to twist the scenario to have it real and meaningful and as close to real life practice in a culturally diverse context. So perhaps changing the name of the patient on the scenario, perhaps changing the religious beliefs, or the linguistic issues. So really working with community partners to ensure that we have scenarios that are reflective of our culturally diverse healthcare settings. But I
Wow.
also believe that I think there's a real opportunity in our classrooms now. So I don't, particularly from an Irish context, we're seeing Ireland as a country has moved from a relatively monocultural society 20 years ago to now we're a much more wider culturally diverse society. And we have over 13% of our population are from cultural and ethnic and linguistic backgrounds. So, we're seeing a much more culturally diverse society. Um, but it's new, it's rapid. So, unlike other countries, perhaps that have been wider in cultural diversity for decades, it's a relatively new phenomenon for us in Ireland. And now we're seeing our nursing classrooms are much more culturally diverse.
Diverse. Yeah.
So there's a real opportunity here when we have international trained nurses, Irish trained nurses, all coming together in that fruitfulness of an intercultural learning environment where students come from diverse cultural, ethnic, and linguistic backgrounds, but also different practice experiences, and indeed different educational experiences, and
Yeah.
bringing them together really provides a fruitful learning opportunity where students can learn with, from, and about students from other cultures. And I found that this is particularly a way for us as nurse educators to ensure that the thread of cultural competence happens for all students, but it's using the learning environment that is culturally diverse to support that.
Mm.
So that's been really, really important. And in doing so, I've done some work, some research on this recently, where we've explored the experiences of, educators and international students and domestic or home students, what their perspectives has been on this learning environment that is now much more intercultural. And what's really striking is the value that they place on that intercultural learning as a way of preparing them for culturally diverse healthcare services. However, it does need to be carefully managed, and really does need facilitators as educators who can manage that culturally diverse learning scenario.
Yeah. And I mean, it looks like it's like you're explaining it like it's very simple and like very easy to accomplish. But I understand that this is hard work, and you are doing a great, you and your team are making a great job. So congratulations. And what is the biggest challenge you have found working with healthcare professionals in this case, and how did you address these challenges?
Yeah. Um, I suppose I was very lucky when I worked in the UK and I moved back from the UK. I moved back to Ireland, but I moved back after having opportunities to learn from experts in the field. So one of the things that I did, so my PhD where I was supervised by Dr. Mary Tilkey and Dr. Georgina Taylor, I developed a theory of resigned indifference. And I think what that's really helpful for me in overcoming my challenges is the theory of resigned indifference helps explain the behaviours of nurses when caring for patients from diverse cultural, ethnic and linguistic backgrounds in Irish healthcare settings. And one of the things that that theory really, I suppose, identified is that nurses want to do a good job. They really do want to provide good quality care,
Yeah.
but that they feel unsure or uncertain. So they're worried that they're going to do the wrong thing or say the wrong thing or upset a patient or be politically incorrect in their interaction with patients from diverse cultural and ethnic backgrounds. But instead of finding answers, what my research found, so instead of finding answers when they were unsure, um, it, they spiraled into a raft of disengagement strategies. So they pretended that they didn't have stereotypes. So they
Huh.
had stereotypes, maybe left them at the door, came in, cared for their patients, and collected them again on their way out without spending time thinking about them, challenging them, and addressing them. They also distanced themselves from patients. So, focused on providing the physical care needs for the patients as opposed to meaningfully engaging with their patients. And as a result, culturally insensitive care was happening. But nobody questioned it. They didn't question it themselves, and none of their colleagues questioned it. So this indifference becomes perpetrated and continues in a continuous cycle. So that theory of resigned indifference for me helps explain what are some of the challenges when thinking or planning providing care for patients from culturally and linguistic and ethnically diverse backgrounds. So what we need to work on is firstly addressing the issue that it's okay to feel unsure, it's
Hmm.
okay to be not au fait with all the cultural norms for different patients, and acknowledging that there are cultural differences within cultural groupings as well as across cultural groupings, but to feel comfortable and courageous to question ourselves and to question others. And that is what needs to happen. So one of the biggest challenges, I think, is this feeling of the need to have this knowledge base to be able to provide good quality care in culturally responsive ways. And that very much is sometimes seen as a spiraling of that uncertainty.
Yeah.
So having that insight into that theory really, I suppose, synopsisizes some of the challenges that I've had as a healthcare professional working in Ireland, but also as a nurse educator, so a healthcare educator. So getting buy-in from colleagues, having this collective approach that we're all collectively, feeling comfortable to question ourselves and to question others, to learn with each other and from each other. And really looking at that in a way that embraces cultural responsiveness and nurtures environments that are inclusive, respectful of both individual and collective patient needs, but also student needs and colleague needs. And I think higher education institutes need to emphasise the importance of this through mandating education and training in cultural competence development, so that we as educators can adopt culturally responsive pedagogies and culturally responsive classroom management strategies,
Mm.
but also in our healthcare services. We need a bottom up approach and a top down approach. So we need individual, I suppose, commitment to not just the commitment to provide a good job, but to provide a good job that meets the needs of patients from diverse cultural, ethnic, and linguistic backgrounds. But we also need a top-down approach where, we can't say anymore that we're not questioning practices and questioning ourselves. So it's about having this adaptability. So getting the buy-in from our colleagues is important. And I suppose having that collective commitment is a challenge, and having an organizational culture that supports the emphasis on being culturally responsive in our practices, providing good quality care, but in culturally
Yeah.
responsive ways.
Yeah. Well, well, actually, I've been, I mean, I have listened so many times this expression of down to top and top to down, but with not so very good examples. And this mini lecture you gave us today, it's been very clear to me. It's like the perfect example of what does down to top or top to down means. And also for me, what you said is like the perfect merge, I think is the word, like fusion of practice and theory and evidence. I mean, you gave us like a very like a mini lecture of what is practice and theory. I love I love that. And Kathleen, how do you foster an inclusive and supportive environment for both students and patients coming from diverse cultural backgrounds?
Yeah. Um, I think creating an inclusive environment involves, firstly, active listening. So, actively listening to the needs and concerns of the patient population or the student population, really focusing on building that relationship with those populations and creating this safe space where there is a mutual understanding, but a sense that it's okay to ask for clarity when unsure. It's okay
Mm-hmm.
to not know everything, but also creating this supportive environment where students feel comfortable discussing and really exploring different perspectives of cultural beliefs and values and norms. So, creating this space that it's okay to talk, to learn, to share. And I think being very much innovative and adopting culturally responsive teaching methods, both as an educator, but also as a healthcare practitioner who provides health education. And I think they're core to nurturing this inclusiveness, but also providing activities that encourage reflections so
Yeah,
as that we're continuously striving to develop our knowledge, skills, and attitudes. And I think that's the biggest learning I've had in my career. You know, it's a continuous cycle of learning. I go into a classroom or I go on to a ward to support students while learning in practice. And I'm still on a continuous learning cycle. Every day is a learning day.
it is
But if I was to kind of say what are the key things, it's about really understanding the needs, facilitating respectful discussions, and encouraging that dialogue. So, recognizing and challenging biases, reviewing our perceptions and
totally,
conceptualizations of cultural difference. You know, which really does mean we get too hung up on seeing the cultural differences, and we need to stop and think actually when I'm nursing a patient, it's providing good quality care, but how do I ensure I'm being culturally responsive? And that does mean, firstly, exploring the similarities in care needs, negotiating with the patient about their health beliefs or their cultural norms or traditions that might inform their expectations of healthcare, and for us to be resilient and adapting to ensure that we are meeting those needs. And sometimes that does mean re-educating ourselves and
totally, yeah.
others.
Yeah,
Yeah.
yeah, and it's not an easy process. I mean, it requires time and dedication. So yeah, and I also wrote down an example because I have worked with trans people, and they always ask us to ask. I mean, if you don't know what to say or what to do, ask me. I'm the one who knows what I want to, how I want to be treated, and how I want to be asked for things or whatever. So it's okay to not knowing. So if you don't know, ask. It's so simple at the end. And finally, this is my last question, which I always ask to all the experts who are participating in these ETNA talks. What advice would you give to nurses who are just beginning to work in multicultural environments and they want to build the cultural competence?
And I think, you know, the first one is just what you've said actually, is feel comfortable to ask. It's okay. And actually, that is what we would be wanting our nurses to do. That's what our patients want our nurses to do. Um, so feeling comfortable to ask. My advice would be to be proactive in learning and being proactive in the sense of, it's not about reading a textbook or a list of do's and don'ts. In fact, quite the opposite. Be proactive in the interaction, in the moment. Take advantage of the learning opportunities while engaging with patients, while engaging with colleagues who perhaps come from diverse cultural, ethnic, and linguistic backgrounds. And really be proactive in using those as learning opportunities and teaching moments, really.
Mm-hmm.
And remember that cultural competence is a continuous journey,
Good.
it's not a destination. But what is important is that we remain committed to constantly striving to improve our practices, our attitudes, and our behaviors. And to start with the self, we can't provide care to patients without stopping and thinking, actually, what types of care do I like?
Mm-hmm.
And what types of care might be similar to caring for another patient who perhaps comes from a different background to me, and feeling comfortable to start at that space. But my research has shown me that, nurses want to do a good job,
Yep.
and they just feel unsure and uncertain. And I think what we need to do is to replace that uncertainty, to stop over focusing on, being unsure or not knowing, and to replace it with courage to ask questions, courage to question yourself and to question others. Commitment to continuously strive to improve your knowledge, skills, and attitudes, but to also commitment to continuously reflect on ourselves and to think about ways of improving our practices. And to bring it straight back to actually being person centered is about being respectful. And it's about asking our patients, you know, challenging the narrative around what we believe, and to bring in this approach of little and often learning.
Yeah. Yeah. Wow, Dr. Markey. I mean, it's been half an hour. I don't know, like incredible. Thank you for sharing your insights and your experiences, and your dedication to advancing transcultural nursing is truly inspiring. I mean, it's been a pleasure chatting with you, and that's all from my side.
And thank you so much for this opportunity. It's been amazing. Thank you.
Thank you so much. And to our listeners, if you enjoyed this conversation, become an Aetna member for free by visiting our website. And don't forget to subscribe to the ETNAtalks podcast for more inspiring stories and expert insights. Thank you for tuning in. Bye.